Hypothermia is thought to be responsible for the deaths of at least 29 children and babies in a refugee camp in northeastern Syria. Around 23,000 people, mostly women and children, have arrived at the al-Hol camp in the past 8 weeks after fleeing fighting. The World Health Organization says many families travelled there on foot in freezing weather. The children and babies are reported to have died either along the way or soon after they arrived. We can speak now to the World Health Organization's representative in Damascus, that is Elizabeth Hoff. Thanks for being with us on the programme. Give us some idea what the conditions are like in the camp. How bad are they and why are things so bad?
The situation is very difficult. There are many displaced. It was in the camp 10,000 people in December. Today there are 33,000 people. So we have had a substantial increase and the situation is overwhelming. Unfortunately, we have lost 29 babies and infants over the last couple of months, and this is mainly because of hypothermia and also hypoglycemia. So it is the cold weather compared to the long road that these families have to travel, and it is very difficult to feed the infants, the newborns and the infants for the mothers on the road. And when they come to the camp, they often have to wait for some time before they get to the tents. And most of the babies and the infants have been lost during the first hours of arrival.
It's a horrendous situation. Is there actually heating in the camp itself, and they are simply dying from the hypothermia because of the journey that they've had to make?
It is a very long and stressful journey, and many of them are stopping at the al-Umari oil field for screening for 2-3 days in the cold weather, and we have no access to these families to help them on the road. So when they come to the camp, they are exhausted, and there is no proper heating, and the temperature is freezing.
What about access to humanitarian aid? What is the World Health Organization doing to help these people? And are you able to freely come and go and bring supplies to the camp?
Yeah, in the camp we have no access. We have 2 mobile teams, 2 mobile clinics and 4 medical health teams working around the clock, and we have delivered 35,000 treatments. But this is often too late. What we are pleading for is really access to the families, particularly those with newborn and infants on the road, so that we can reach them already at the Umari oil field, where they are stopped for screening. So this is something that we don't have access to today, and it is very much needed so we can prevent unnecessary deaths.
And who is stopping that access? Which groups?
The forces in control of the area are stopping and are not giving us permission to access the area.
And in terms of where these people have come from, give us an idea of that area. Who are these women and children, and which sort of fighting have they fled from? Which part of the country have they travelled from?
The families are coming from Hajin. This is a pocket in the area of rural Deir Az Zor, which has been under military attack for some time, and they are fleeing this area for safety. But unfortunately, it is a very long distance, 250 kilometers, for them to reach the camp in al-Hol camp. And they are stopped for 2-3 days already for screening on the road in Umari oil field.
Elizabeth Hoff, really appreciate you talking to us. Thank you for joining us there from Damascus.
Thank you.